I felt like I was increasingly being perceived as the enemy. I am a very empathetic, passionate person. I can't function in fight or flight all the time and be able to still do good for the world.
Dr. Amber Hull is a U.S. board-certified and Canada-licensed physician specializing in integrative women's health across the lifespan. She's a humanitarian, an American immigrant, and a writer who explores the root causes of chronic stress and the impact of technology on our humanity.
Every single day that you're going to work in the United States, I feel so threatened or on edge. There's just this sense of hyper-vigilance. It's like always being in fight or flight response. A lot of nurses quit. A lot of physicians took a step back. Female physicians specifically have incredibly high rates of burnout. I've worked all over the United States and never did I ever have a conversation with someone to be like, which side of the political aisle are you on, before I took care of them. It didn't matter. We're all Americans.
Welcome to the Interesting MD podcast, the show about what doctors do when we aren't seeing patients and how this can help us find balance and prevent burnout. I'm your host, Rob Beck. Welcome back to another episode of the Interesting MD podcast. I am your host, Rob Beck. I have a wonderful guest today. Her name is Dr. Amber Hull. She is a US-based physician who moved to Canada about 8 months ago. And she's here to tell the story about why she moved and then talked about the process. And this is going to be a two-part episode just because we had such a great conversation. And I'm hoping actually to bring her on again because she's really fascinating. This first episode is going to be about who she is, her practice, where she came from, grew up, and also her reasons for moving to Canada. It's very easy to think that doctors are only moving to Canada because of politics, and it's really not that. And she has some really brilliant insight and said things that really spoke to me and were exactly the way that I felt and the way that I continue to feel. I think what you're going to find is that she has some very relatable insights, and anybody who practices medicine in the United States is going to know what she talks about. This is transcendent to politics. This is not right. This isn't left. This is physician burnout. If this does speak to you, if this is something that you want to talk about, I am getting tons of emails. I am on phone calls now with a lot of you, and I really appreciate you reaching out. I'm now here trying to help with arranging logistics and helping to introduce you to people. So please give me a call, email me. rob@interestingmd.com. Again, rob@interestingmd.com. And I'll be more than happy to set up a time we can talk and I can answer any kind of questions that you might have. I hope that you enjoyed this episode with Dr. Amber Hull. Please welcome to the show, Dr. Amber Hull. Amber, thank you so much for coming on.
Thank you so much for the invitation, Rob. I've been looking forward to talking with you, and I love what you're up to with this podcast.
No, thank you so much. Yeah, so Amber actually reached out to me, and this is one of my favorite things about doing this is that every once in a while somebody finds me on LinkedIn or some other social media thing, and I love it. I love to get to meet new people. We had, a 45-minute conversation. I was at work and I walked outside and was standing next to the helicopter to the helipad and had one of the most fascinating conversations I've had in a while of just talking to another doctor who's been through a lot of the same things and who has just a fascinating story. So I really appreciate you coming on.
Yeah, thank you so much. I'm excited to share my experience, such as it is. And it's always interesting meeting other American doctors and healthcare workers who have made the jump here. And, frankly, one of your colleagues out on the island in Nanaimo was sort of the person who I was introduced to, who didn't necessarily hold my hand through the process, but just sort of provided a little bit of reassurance of yes, this is a viable pathway. Yes, your concerns are valid. You will be valued here. It can be done. And so I think it's helpful, whether someone's staying in the United States or considering coming here, just to sort of hear the experiences of others, because, being a doctor is kind of the least interesting thing about me, I think.
I think people who are not doctors always think, oh, no, that's got to definitely be the most exciting thing about you. And it's like, no, I mean, sure, there's lots of great stories that you can tell at cocktail parties. But other than that, no, it's not all that exciting. And there's so many other things. And we're going to hear about a lot of those today as well. So do you mind just telling everybody a little bit about you? You know, where you're from, where you grew up, where'd you go to school?
Yeah, absolutely. Yeah. My name is Dr. Amber Hall. I am an integrative women's health physician here in British Columbia and Vancouver, BC. At this point, I practice mostly menopause, hormone therapy, but I also do integrative women's health kind of through the lifespan. My board certification in the United States is in pediatrics. And so this is a little bit of kind of like a convoluted story, but I think not terribly uncommon. I did my undergrad at the University of Colorado in Boulder, which is sort of like a kindred spirit, I think, to like Western British Columbia. And so I studied integrative physiology there, went to the Arizona College of Osteopathic Medicine in Phoenix. And kind of like the through line to that was that there's an osteopathic training in the United States. We are essentially equivalent to an MD. And from the standpoint of the Medical Council of Canada, my training as a DO in the United States is equivalent to Canadian MD training. But within osteopathic medicine and like the tenets of osteopathic medicine, there's very much this focus on the mind, body, and spirit. And these things are interrelated. And, you know, if your spirit is crushed by your circumstances, then it's going to be difficult for you to maintain good physical and mental health. And likewise, if there's something physically wrong with your body, it's going to affect your mental health and your spirit. And these, you know, it's all interrelated. While I was an osteopathic medical student, I thought I wanted to be an OBGYN. And I did all of my training, like all of my elective rotations in medical school, I did in like GYN oncology and pelvic floor reconstructive surgery, high-risk pregnancy and delivery. I went and caught babies on the border, like down in Yuma, Arizona, and was like first assist on C-sections as like a third and fourth year medical student. But everyone that I worked with in the States was like, if you go into obstetrics and gynecology, you're going to get sued, like probably more than once in your career. I heard that in emergency medicine too. There was just this sort of like conditioning throughout medical training of like your patients are your enemy. They're going to come after you and you're going to get sued.
It's an us versus them mentality. Yeah,
absolutely. Yeah. And which I think has only gotten worse, but I digress. So ultimately, as a medical student, I had done, like before I went to medical school, I did research in pediatric endocrinology at the Children's Hospital in Denver for like 2.5 years before I went to medical school. So I had this also foundation in like metabolism and insulin resistance and cardiovascular disease and renal disease and physical activity. And I had done kind of like all of that and, you know, before even going to medical school. And so as a med student, I was like, I just don't want the litigiousness and the lifestyle of an OBGYN. So I decided to do pediatrics instead. And I love children, and children are not just little adults. The physiology, as you know, is with these little guys, especially like the littler they are, the more kind of like, you know, you can't trust their physiology.
Right.
So as I did my residency in pediatrics in Baltimore, Maryland, I did all of my subspecialty training, mostly at Johns Hopkins, a little bit at the University of Maryland, and still was very interested in like maternal child health and pregnancy and peripartum. So I focused on neonatology and like high-risk pregnancy and delivery. Actually did a year of newborn intensive care fellowship down in Portland, Oregon, before I just, again, like my spirit was crushed by being in the NICU. And I ended up getting a stress fracture out of the blue at the end of my first year of fellowship, and was like, maybe my body is trying to tell me something here. So I threw in the towel on fellowship, took a job on the coast in Oregon, and ended up moving back to Las Vegas because about my first to second year out of training, my nephew was diagnosed with level 3 autism and was having some neurologic manifestations of that diagnosis. So I wanted to be closer to my family in Arizona. So I moved to Vegas to be closer to my family. And it was kind of like from training, it was like out of the frying pan and into the fire of COVID. Because like 6 months after I started an attending job in Vegas, COVID hit. And, I slogged through the trenches of COVID until 2021, when again, I had a pathological femur fracture this time. And ended up losing my health insurance without notice. My paychecks were cut off without notice. I had to learn to walk again. I built a business of a practice of my own from the ground up in Vegas as a result of being disabled, and really like bootstrapped my way like through all of that. And I had my own practice in Vegas for about 4 years before I just was like, this is just exhausting. And now there's this regime that is putting a target on my back. And, every conversation that I'm having clinically is renegotiating the safety of vaccines, for example, and like conversations around giving raw milk to toddlers and homeschooling because people don't trust the educational system, and avoiding the hospital because people don't trust the healthcare system, and, gun safety because everywhere where I live, like everyone owned weapons, and, fights breaking out at school. And it just became so exhausting that I was like, what am I going to do here? So
I feel a lot of that. And I think that not only but I think that anybody who's watching this can feel the pain that you're having, the sacrifice that you make, this ultimately, it was intended to be a show about burnout. Now I'm a moving consultant. But this is one of the hardest things about medicine these days, and one of the things that led to so much burnout for me during COVID, leading up to COVID too. I cannot just blame COVID. I think that was just the straw that broke the camel's back. But just the constant fight, the adversarial nature of everything, and it's not just with the patients. It was with the insurance companies. It was with administration. It was in like the hospital administration. Even though my administrators were great, I loved them. They were good people, but it was still not always a great relationship. I feel everything that, when I watch you do this, I can feel your pain with everything that you were going through and with those conversations that you were having. And I understand that. And I think that there are a lot of people out there who are experiencing that same thing. Do we really need to relitigate absolutely everything that we've proven over the last 100 years? And I know exactly where you were.
It's a lot. And, I think a lot of people quit medicine before, like around COVID and after COVID. Like a lot of nurses quit, a lot of physicians took a step back. Female physicians specifically have incredibly high rates of burnout. I want to say it's like on the order of like 30% by 7 years in practice. I'm talking about as an attending, not training, but as an attending, like 7 years into practice, something like 30% of female physicians are planning an exit strategy. And women physicians have incredibly good outcome measures. Patients like being taken care of, especially women patients and children, I would argue too, like being taken care of by female physicians. But like, I know so many women physicians who are like, do I go become a medfluencer? Do I go to work for the pharmaceutical industry? Do I, throw in the towel and go work for the enemy at the insurance company doing chart reviews because I feel so like threatened or on edge? There's just this like sense of hyper-vigilance. It's like always being in fight or flight response, like every single day that you're going to work in the United States, whether it's around, insurance and payment structures or increasingly polarized political conversations. And, Rob, I, in my training, worked from Baltimore, Maryland to Tulsa, Oklahoma to, the border in Yuma, Dallas, Portland, Denver. I've worked all over the United States, and never did I ever have a conversation with someone to be like, which side of the political aisle are you on, before I took care of them. Like, it didn't matter. We're all Americans. And I felt like I was increasingly being perceived as, like, deliberately being painted as the enemy. And I am a very empathetic, passionate person. And like, I can't function in fight or flight all the time and be able to still do good for the world. So, you know, that's sort of like the backdrop, but also kind of like to turn it into a little bit more like optimistic trajectory too. Yeah. Having my own practice in Vegas and having that sort of like really deep understanding of, you know, neonatology and high risk pregnancy and delivery. I kind of moved into more where most of the patients who came to me in my direct primary care practice came to me when they were still pregnant. So I was able to like usher couples and, you know, women and couples through this experience of third trimester pregnancy, preparing them for childbirth, immediately postpartum, and, you know, the first few years of parenting, which is a huge transition in people's lives. Yeah. You know, and one that I think the medical community doesn't have either the resources or the training to truly prepare people for. So I was talking with people about, you know, getting pelvic floor physical therapy before they delivered the baby. And, you know, like the postpartum hormone drop that happens, which really mimics menopause in the postpartum, and like really spending time with people and sort of like clocking what was going on with their mental health, like checking in with women about like, how's your body doing? How's your relationship with your partner doing? Are you guys like, do you have any time for intimacy? And is your partner, especially if they're a heterosexual male partner, are they understanding about the fact that this is a chapter in your relationship together? It's not the whole book, because those early days of parenting can be very challenging. And so I started taking more classes in like women's sexual health. And I joined the International Society for the Study of Women's Sexual Health, started studying hormone therapy just for my own purposes, because I was becoming perimenopausal at that point too. I was like, what the heck is going on? And started really kind of like going back to my roots in women's health, hormone, integrative medicine, and also just the importance of like connection and playfulness that adds so much to our experience as humans, right? And so doing all of that training in addition to it, like I still maintain my pediatric board certification, but I was like, this is like really interesting, like juicy stuff, right?
Right.
And so I started writing on Substack like in early 2024. And it's the only social media platform I'm on. Like I don't have my LinkedIn anymore. I've never really used Instagram. I've never used TikTok. Like I'm not all of that. Like I do Substack, but I was writing about these kind of like more, I don't know, playful, cultural, esoteric topics. And I was finding real joy in doing that and like making myself knowledgeable enough and sensitive enough to have those conversations with patients. And so like when I came here, one of the things that I said, because I reached out to this clinic specifically where I'm working, because I was like, I want to get back to integrative women's health. I'm going to need some mentorship. I'm going to need some guidance in terms of, you know, navigating the Canadian healthcare system. But this is what I'm bringing to the table. Are you interested in having me come and work here? And they were like, yes. You are like, of course you're valuable. Of course we want you here. Like, what can we do? What can we do to get you here? And so now I sort of have like reimagined the next chapter of my career where I can really go into kind of the mind-body connection, nervous system regulation in a way that, you know, allows people to get off of SSRIs or avoid SSRIs entirely, you know, encourages playfulness and, you know, asks questions and really like, I don't feel like an adversary to my patients anymore. Like I feel like the advocate that I have always wanted to be. That was kind of like the trajectory. It kind of went a little bit dark there, but I wanted to bring it back around to something like positive.
That's where healthcare is these days,
Yeah.
is that there are some really, really dark times. There are some dark things that happen. And I think that you and I have both talked about our moves to Canada. While everybody thinks that you're leaving because of politics, it's more than that. It's actually just why, like you said, you're always in a fight or flight mode. Why does every potential encounter that you have to be potentially, why does it have to be adversarial?
Yeah.
Why does every parent want to relitigate vaccines, and why do you have to start doing that? And what's the motivation? I understand that person's motivation is care for their child, but my God, it's just terrible. To talk about statins, to talk about the flu vaccine, the pneumonia vaccine, the COVID vaccine, handgun safety. As I was on my way out, just to talk about this, I would talk to all of my patients about gun safety. I always had lifestyle things that I would talk to them about during our physicals. And, it was like, don't look at your phone when you drive, don't drink and drive, those kinds of silly things. Wear a helmet if you're going to ride the e-scooters, or just stay off of the scooters. But I would talk about, if you have guns, make sure that they're locked up. The NRA says that. That's like an NRA talking point. That is so apolitical. But I had 5 patients die by suicide. They were all men, and they were all by guns. And I had 3 patients who were murdered. Wow. And that is something that really means something to me. And that is something that is a huge problem. 48,000 people die a year because of guns. And children were dying. I've talked about this in other episodes, but some of my son's classmates were shot, or their little sisters were killed because a 2-year-old got a handgun. And so just talking about those things, that is again, literally not political. It is a safety thing. And just like saying wear seatbelts and don't smoke, that kills a lot of people.
Yeah. In the United States, it kills a lot of people in the United States.
Yeah. In the United States. Yes. But I had one woman just stand up and be like, that's none of your business. Stay in your lane. And I had already made the decision to, I'd already announced that I was leaving. And so I was like, you know what? That's fine. I'm not the doctor for you, and that's fine. But I wasn't trying to make a political statement. It wasn't about politics at all. And I tried to keep politics out of it because I want all of my patients to know that I have their best interest at heart, but they don't see it like that all the time. And that kills your spirit. That, as you talked about, it crushes your spirit. And I think that what I have found is that there is less politics here in Canada, much less politics here in Canada, and that it's just not this constant fight, this constant struggle. And you can be the most right-leaning conservative doctor or the most left-leaning conservative doctor, and you still have conflict with your patients. You still have conflict with your administrators and with the insurance companies, and payments and reimbursements and everything else. Everything can still feel like a potential conflict. And I think that people just want something different. I mean, that's why people are burning out, why they're leaving. And it's just a constant struggle.
Well, I think I agree with everything that you said, and my condolences on, just every loss of a patient is devastating. But when it's something that is just so preventable, and especially if it's a child and it feels that preventable, it hits that much harder. And, I think it's important to recognize that, as physicians, and you're a parent, and, just as a human, you don't really ever get over that. Grief doesn't shrink. We grow around it. And that kind of grieving, I think, is, something that, at least I'll speak for myself, we weren't allowed time for that in residency. It was oh, you're depressed, take this antidepressant. Oh, you have anxiety, take this benzodiazepine. Oh, you can't sleep, take this sleeping pill. And there's so much of like the structure and the institutions of medicine that I've been vocally critical of. And I write about this on my Substack too. Like, far be it from me to be an apologist for the institution of American medicine. It is like drenched in the blood of enslaved people and misogyny and bias. And there's a reason, right, that the public doesn't trust us. And I'm not blind to that. And also, you know, the first orientation session that I went to as a resident, like the first 2 lectures were how not to get fired and how not to get sued. And it just puts you in this like constant defensive
welcome
crap.
to medicine.
Exactly. Yeah. And like, I remember like, and I started watching season 2 of The Pit last night because, you know, I'm evidently like self-flagellating is an exciting thing for me, but like, you know, and I'm just like, it gives me real flashbacks of training. And I thought it was very poignant, like spoiler alert, that Noah Wiley rode his motorcycle in without a helmet. And it shows the sort of like level of passive death wish that I think a lot of American physicians are dealing with. And also, like, I've been in Canada for about 8 months now. I don't know when this is going to air. I'm grateful every single day to be here. There's not a day that goes by that I don't check my mailbox looking for my permanent residency paperwork admission. And I know that it's probably not going to be here for at least another year. And I just am so grateful to be here. And I've had conversations with my mentors here who are like, you don't have to be so defensive. You know, you don't have to assume that your patients are going to come after you. Like, that just is not a thing here. Like, you have a very unique skill set and you should take ownership of that and not apologize for it. And it's just this sort of like, you know, my intention for the year going forward is to do like a yin yoga teacher training and, you know, maybe to do some classes on nonviolent communication. And, you know, Gabor Mate is from here. I don't know if you're familiar with his work, but.
So yes, Miriam Zainadin, which has been on my podcast a couple of times already. She's in West Vancouver, and she is kind of Gabor Mate was one of her mentors, and she knew him really well and knows him really well. And so, yes, I'm very familiar with the name. I haven't read his stuff yet.
Yeah. And there are people who are critical of his work too and are like, you know, everything is not caused by trauma, but a lot of things are caused by trauma. But again, just sort of like this past year, in addition to an international move and learning about international banking and getting my BC driver's license, which was a whole thing, right?
Yes.
I got certified as a Menopause Society certified practitioner, and I really like went in hard on the hormone side of things and made sure I really have that dialed in. And I still learn every day. And like, my colleagues are amazing and we, you know, work collaboratively here. And so this year I'm really kind of focusing on, you know, disconnecting from social media, focusing on the mind body, building community, building in real life relationships, like laying down roots here in Vancouver. And you know, just kind of getting into that softer side of medicine where I'm coming from this perspective of always like being like hard and on edge. Like, I want to lean into softness a little bit. And that doesn't mean that I'm going to be like squishy and just like throw caution to the wind and like disregard science. Of course not. But it goes back, like, this is how I've always been trained. It's integrative physiology, mind, body, spirit, evidence-based, understanding that the evidence base is flawed. And what do we do to sort of adapt to the knowledge that we have, extrapolate what we think is true based on what we know, and like make it sort of like precision dialed into the patient in front of us.
That sounds very nice. I mean, it is very nice to be able, and I'm not saying that in like a condescending, that sounds very nice. Like, it does sound very nice. And I have found that practicing medicine here has been very much like that. I mean, it's hard, it's long. There are certain frustrations, especially on the inpatient side. I don't feel conflict. That is not where my stress comes from.
Yeah, I didn't mean to cut you off, but there's like I think I was reading through, I think it's in the bylaws of like the College of Physicians and Surgeons, which you've said before, but it bears repeating. The College of Physicians and Surgeons of British Columbia is the licensing body here for physicians. And I think there's something in their like bylaws or code of ethics or what have you that is, you know, physicians are expected to behave with a degree of like humility and humbleness, both with colleagues and with patients. And, you know, there's an expectation of collaboration in order to get to the best outcome for the patient. Like there's this expectation here. And I think that that's also reflected, like it's a reflection of the culture more broadly in that, you know, people value pluralism in general, right? Like there's this collective investment in the respect for human life. And I think just the fact that there is universal healthcare here is evidence of that, you know, and it's not perfect, right? It's far from perfect, but just the fact that, you know, if I didn't have insurance in the United States, I couldn't afford it. As a small business owner, I had a health share and a health savings account because I couldn't afford health insurance. I was like, if I end up getting diagnosed with cancer, I could lose my house. And I had been through major disability before, so I knew exactly like how like long-term destabilizing that could be. And here it's like, you know, the healthcare system may not be perfect, but if a screening program picks up an early malignancy, I can go to the BC Cancer Treatment Center and like be treated, and I'm not going to go bankrupt, or I'm not going to delay getting that treatment because I can't afford the deductible. And it's just, to me, it just feels like there's a collective recognition of the value of human life here that I didn't see in the United States. And I'm always very conscious of like, I don't want to come across as like, I don't hate Americans. I don't hate the United States. I just got to a point where I felt like I was in a domestic violence situation and I needed to change that. And I walked away.
Yeah, it's a relationship, right? And you have relationships of all kinds. You have relationships with partners and spouses and family members and patients and colleagues, but you also do have a relationship with your kind of government and with your environment. And yes, in Canada, healthcare is a right. And that's the expectation, is that it is a right. In the United States, unfortunately, it is a luxury. It is a luxury of age. So if you're over 65, great, fantastic. If you have a great paying job, then most likely you will have good benefits, but you may have a huge deductible. And it's different. It's viewed very differently here. And yes, there are longer waits here. So, you know, just to talk about the Canadian healthcare system by people, there are longer waits here than there are in some places. I'd say that it's probably pretty equivalent to working in the VA. So if anybody's worked in the VA, at least in British Columbia, it's the only thing that I can talk about. I think that Ontario may be a little bit different, and there's certainly doctor shortages everywhere. So if you're an American doctor and you want to move up here, you will be welcomed. You will make the system better. Same thing with nurses. But you get everything that you need. And I'm seeing that more and more now that I'm 5 years into it. When I first moved up here, I joked that I worked at Disneyland for doctors. Centennial Medical Center was an amazing medical center in Nashville, and I had amazing colleagues and amazing facilities, and everything happened really fast. Like everything that I wanted, I got it that day, next day, no problem, within a week. I mean, surgical consultations, everything. And moving here, I didn't understand the system. And so I was frustrated a lot by how slow it was. And it was really angering to me. And some of it is still, like I think that there are things that we could do faster. But I also realized that the outcomes aren't any different. In fact, it might actually end up being better here for a lot of patients. Not that waiting 2 years for a hip replacement is a better outcome, but cardiovascular outcomes, things like that, they're not any different. And, if you wait an additional 12 to 24 hours, 36 hours for an angiogram that's urgent but not emergent, I haven't found that makes that much of a difference, or any difference, actually.
Thanks so much for listening to this first part of our conversation with Dr. Amber Hull. I think that you can already see that she is very fascinating and has some incredible insights. Please come back for next week. We're going to talk more about what the actual process is and how she navigated all of this, because this is something that you guys have a lot of questions about as well. So I think this is going to be really great. Again, if you have any questions, email me, rob@interestingmd.com. Again, rob@interestingmd.com. See you next week. Thank you for listening to another episode of the Interesting MD podcast. Please check out my content on YouTube at Interesting MD and follow me on TikTok, Blue Sky, Instagram, Threads, and Facebook at The Interesting MD and on X at Interesting MD. If you have comments or questions and want to get in touch with me or any of my guests, please DM me on socials or email me at rob@interestingmd.com. If you have any ideas for a show and you want to share your hobbies with me or don't know where to get started on your own project, you can email ideas@interestingmd.com. Please like and subscribe to the podcast and YouTube channel to get the latest content. Much appreciation to Falter Media for editing, producing, and posting all Interesting MD content. Check them out, because if they can do this for me, imagine what they can do for you. See you next week.